Okay, now we'll go ahead and start talking about bugs that can cause diarrhea. The first important distinguishing factor is whether the diarrhea is bloody or non-bloody. This is an important clue which you'll see in the question stem and can help you narrow down the organism on step 1. So first, let's start with the bloody diarrheas, and the first one being Campylobacter. Do you remember what kind of bacteria Campylobacter is? It is a gram-negative, comma-shaped organism. And do you remember what is unique about it in terms of its growth? It grows best at 42 degrees Celsius, which is greater than the normal 37 degrees Celsius that most other bacteria grow best at. So you can remember this with the mnemonic, Campylobacter likes a campfire. Campylobacter is a major cause of foodborne illness and can be obtained through animal products as well as domestic animals such as dogs, cattle, or chickens. Do you remember which neurologic disease is associated with a Campylobacter infection? That would be the Guillain-Barré syndrome. Very good. Our next bug that causes bloody diarrhea is Entamoeba histolytica. This is a protozoan species. Do you remember what pathologic finding you would see with an Entamoeba histolytica infection? I'm drawing a flask here to help you remember that you would see a flask-shaped ulcer in the intestinal mucosa, significant of an Entamoeba histolytica infection. EHEC stands for enterohemorrhagic E. coli, also known as E. coli 0157H7. This also causes a bloody diarrhea and presents kind of like Shigella, since it produces a Shiga-like toxin which inactivates which ribosomal subunit? It inactivates the 60S ribosomal subunit. Also, remember that E. coli can cause hemolytic uremic syndrome. And as we talked about in other areas of this lecture, do you remember the triad seen in hemolytic uremic syndrome? You would see an anemia, thrombocytopenia, and an acute renal failure. EIEC stands for Entero-invasive E. coli, and as its name suggests, it actually invades the cells of the intestine and causes a bloody and inflammatory diarrhea. The reason it causes a bloody diarrhea is because it invades the intestinal mucosa. In the cells, it replicates itself, which leads to the recruitment of macrophages and a subsequent inflammatory response. In rare cases, the bacteria can actually invade the bloodstream and cause a bacteremia. This is actually the only E. coli strain that invades epithelial cells of the gut. ETEC, EHEC, and EPEC are other species of E. coli that cause diarrhea by producing a toxin that damages the epithelial cells. Do you remember what other bacteria invades the intestinal mucosa? That would be our friend Shigella. So Salmonella and Shigella also cause bloody diarrhea, and it is important to understand the difference between these two organisms because the disease they can cause is very similar, and this is something that you can be tested on step 1. Now, can you remember some of the key differences between these two bacteria? Take a minute and write as many as you can down. Well, some important differences include that Shigella produces a toxin and it infects at a low infectious dose. Do you remember which one is motile or is motile, can move? That would be Salmonella. Salmonella is like a salmon and is motile, while Shigella is not. Do you know which one is found in animals? Salmonella is found in animals, and Shigella actually is not. It is only found in humans. So now, Shigella requires a low number of bacteria to cause disease, which is what is called small infectious dose. Salmonella requires a lot of bacteria to cause disease. That's called a high infectious dose. Our last bloody diarrhea causing bug is Yersinia enterocolitica. This is a common cause of bloody diarrhea that is found in children in daycare. Do you remember what toxin it produces? It produces a heat-stable toxin similar to the one seen in ETEC, a species of E. coli, that actually activates the GS subunit. Do you remember what disease is mimicked by Yersinia infection? Yersinia infection actually mimics appendicitis. Now let's move on to the watery diarrheas. The first bug on the list is Clostridium difficile. This can actually cause both watery and bloody diarrheas, just to make our life confusing. But when do we see a C. diff infection? We commonly see C. diff infections in patients that are recently treated with antibiotics. Another bug that causes watery diarrhea is enterotoxigenic E. coli, or ETEC, that causes a traveler's diarrhea. Now, this bacteria produces an ST and even an LT toxin. Do you remember how these toxins work? In the case of the ST toxin, it increases cyclic GMP levels by overactivating guanylate cyclase. In the case of the LT toxin, it increases CAMP levels by overactivating adenylate cyclase. Very good. Vibrio cholera, which commonly causes outbreaks in third world countries, causes what is known as a rice water diarrhea. This sort of diarrhea is acquired by drinking contaminated water. These bacteria cause large volume diarrheas, liters and liters of diarrhea per day. Many people actually die from cholera because of the massive dehydration and electrolyte loss. Now, can you tell me what metabolic disturbance is seen in this form of diarrhea? Remember, diarrhea causes a non-anion gap metabolic acidosis. This is a favorite on the boards. Finally, other causes of watery diarrhea include several protozoa, including Giardia and Cryptosporidium, as well as several viruses, including rotavirus, adenovirus, and norovirus. Now time for a flash quiz. Do you remember what disease is mimicked by Yersinia enterocolitis infection? That would be appendicitis. Now let's talk about pneumonia. But first, what is pneumonia? Pneumonia is an infection of the lung parenchyma. The lung parenchyma is also just the substance of the lung. Several different microorganisms can cause pneumonia. A great way to remember which bugs cause pneumonia is to separate them by age groups of the individuals infected. The age of the patient will help us narrow down which bug is most likely the cause. If you ever see fever in a neonate, pneumonia has to be on your differential. Now, what diagnostic test could you order to evaluate a neonate for pneumonia? A chest x-ray is a good, cheap initial test to look for pneumonia. There are two bacteria that cause the majority of pneumonia in neonates. Do you remember what they are? Group B strep and E. coli. Remember, B, as in Group B strep, is for babies. We just mentioned GBS as a colonizer of the vagina earlier in this lecture. Now does it make sense to you why we check pregnant women for GBS before they deliver? Right, because we want to prevent pneumonia in neonates. Children, starting at the age of 4 weeks, up to young adults, up to 18 years, are exposed to more in the outside world and can get pneumonia from a number of different microbes. They can get pneumonia from viruses such as respiratory syncytial virus. They can also get it from bacteria, including Mycoplasma, Chlamydia trachomatis, Chlamydia pneumoniae, as well as strep pneumo. As I mentioned earlier, almost all children will be infected with RSV at some point in their life. To remember the sources of pneumonia that most commonly affect children, we can use the mnemonic runts, may, cough, chunky, sputum. Runts, may, cough, chunky, sputum. Pneumonia in adults is often due to similar organisms as pneumonia in children, with some changes. Although we do see it with Mycoplasma, Chlamydia pneumoniae, and strep pneumo. The only big difference between children is we do not see a lot of pneumonia caused by RSV or caused by Chlamydia trachomatis. Older adults, above the age of 40, can also get pneumonia from strep pneumo and Mycoplasma, but they also can get it from Haemophilus influenza, also known as flu, anaerobes, and in some viruses. Finally, in the elderly, the most common sources of pneumonia are strep pneumo, influenza virus, anaerobes, Haemophilus influenza, and then some gram-negative rods. With these age categories in mind, I hope it'll be much easier for you to remember and answer a question about pneumonia on the boards. So in addition to thinking about the causes of pneumonia by age, there are also special groups of people that are more susceptible to specific types of pneumonia. For instance, can anyone tell me the most common source of pneumonia in alcoholics? It's still strep pneumo, but we can also see that it can be caused by Klebsiella or Staphylococcus. Do you remember what kind of sputum we would see in a patient with Klebsiella? We would see that characteristic red currant jelly sputum. Pneumonia caused by aspiration is often caused by anaerobic bacteria. And why does this make sense? What is aspiration? Well, remember, aspiration is when gastric or gut contents is coughed up and then inhaled into the lungs. This is a very dangerous complication seen in specific groups of patients. Can you name 2 high-yield groups of patients that are susceptible to aspiration pneumonia? You got it. That's patients who have problems with alcohol or alcoholics, as well as patients that suffer from seizure disorders. So whenever you see somebody with a seizure disorder with pneumonia, you must consider aspiration pneumonia. And why are anaerobes typically seen in aspiration pneumonia? Because our gut flora are anaerobic bacteria. Mycoplasma, Legionella, and Chlamydia are atypical causes of pneumonia. And why is it called atypical? Well, because these are atypical bacteria. They do not show up classically on gram stain because there is something unique about them. Do you remember what is unique about mycoplasma? Mycoplasma doesn't have a cell wall and therefore is not going to show up on gram stain. Mycoplasma causes a more mild pneumonia that is also called walking pneumonia. The X-ray will oftentimes look worse than the patient's clinical presentation. Typically, it is not very severe, and the patients are able to walk, which gives it its name, walking pneumonia. Do you remember what is unique about Legionella and Chlamydia? Remember, they are primary intracellular organisms. Patients with cystic fibrosis are most likely to get pneumonia from Pseudomonas species. Why? Well, because Pseudomonas are often found on nebulizers that are used to help with mucus secretions, and Pseudomonas is a water-loving bacteria. Thinking back to cystic fibrosis, do you remember what protein is mutated in this disease? Remember, that is the CFTR chloride channel. Pneumonia in immunocompromised individuals can be caused by Staph aureus, enteric gram-negative rods, as well as fungi, viruses, and Pneumocystis cerevisiae pneumonia. Pneumocystis is commonly seen in patients with HIV. So now, what is the most common cause of pneumonia in these immunocompromised patients? This is a great trick question that the boards love. The most common is strep pneumo because it is the most common bug that causes pneumonia, whether or not the patient is immunocompromised. So it doesn't matter that this patient is immunocompromised. The most common bug that causes pneumonia is strep pneumoniae. What does nosocomial mean? It means that it's hospital-acquired. Hospital-acquired or nosocomial pneumonia is most commonly caused by Staph aureus, Pseudomonas, or enteric gram-negative rods. Anytime you have a patient that is in a hospital or a nursing home that comes in with pneumonia, you need to make sure to cover with appropriate antibiotic coverage for Staph aureus and Pseudomonas, and actually you need to even cover for MRSA. Do you remember the first-line treatment for MRSA? That would be our good buddy vancomycin. Very good. Now, patients with recent viral infections who are post-viral, can often get pneumonia from Staph aureus, H. influenza, or Strep pneumoniae. This is known as a secondary pneumonia, where the bacterial pneumonia is superimposed on the viral pneumonia. And why does this happen? Well, it's actually pretty cool. Viruses infect the cells of the throat and upper airway and cause inflammation. The inflammation causes pharyngeal cells, or cells of the pharynx, to swell. This swelling actually causes the cells to lose the activity or lose the function of their microvilli, which are responsible for brushing up the bacteria and keeping them out of the lungs. So the swelling of the cells reduces the function of the microvilli, which then causes an ineffective function of the villi, leading to reduced ability to brush up and get away the bacteria and keeping them out of the lungs. So when the villi become more blunted because of the swelling, they can't remove the bacteria. This makes the individual more susceptible to bacterial pneumonia from these three organisms.